Welcome. My name is Michael Lucido, and I'm a physical therapist, and I am a teacher and instructor with the North American Institute of Orthopedic Manual Therapy, also known as NAIOMT. Today I'm doing a series of videos that will primarily be used for our online education. And I'm using these videos, as I call these, the best of NAIOMT, the best of the North American Institute of Orthopedic Manual Therapy, giving you a taste of some of our different theory and practice that would then give you a sense of where we're going as an institute and whether you'd like to join us or not. Other techniques, as well as practice and theory of NAIOMT that I consider the best of NAIOMT is actually in the upper cervical spine. We've already showed you one particular technique, and I want to show you another one. So I'm going to move to the head of the bed, and we're actually going to do a technique as well as an assessment while I'm standing. So I'm going to move my chair out of the way, and again, this is ideal for a patient that's got mild to moderate symptoms on the left side of their head. Perhaps the referral is coming to their eye or around the side of the head. And we're going to do an assessment of the upper cervical spine, primarily of the occipito-atlanto joint. And the way we do that is by bringing our hands very wide. We teach that the axis is going through the ears. And we basically get very comfortable with our hands going up and down, introducing motion at the OA complex. And then, knowing that his pain is on the left, we would then take the OA complex at in-range assessment into posterior glide, and then in-range assessment into anterior glide, and compare sides. We would then take OA into posterior glide on the right, anterior glide on the right as well. In that assessment, we would then pick up a loss of glide, in this particular example, loss of glide into anterior glide of the occipito-atlanto joint on the left. So when I did an assessment using biomechanical principles, using side bending and translation, gliding the occiput on the atlas up on the left side, I feel a hard block, what we call a pathomechanical block, and a manipulative thrust is actually the best treatment for that. So what's really good about our techniques is when we get the assessment down very nicely, our techniques are really a progression from the assessment. We just change our hand hold. So we come into the back of the left ear. We're going to put Luke in the exact same position. There is OA extension. We're going to left side bend and translate. We're going to engage our barrier with a little bit more, little compression through the head. OA extension with a little bit more translation and deliver a thrust in that position that then addresses the pathomechanical infield of the left OA joint.